Good afternoon, everyone. A very warm welcome to our series on understanding the silent threat, liver cancer awareness, organized by Voice of Healthcare in collaboration with Isai Pharmaceuticals. I am Dr. Muskan Ahlawat, representing Voice of Healthcare. I welcome you all who have joined today's session with us, which reflects how deeply we care about our health and well being. Among all the organs that silently sustain us, the liver plays a remarkable role, detoxifying our body, aiding digestion, storing energy, and keeping our metabolism in balance. Yet, despite its importance, liver disease often progresses quietly, showing very few early signs. That's why awareness, prevention, and timely interventions are vital. In today's time, when unhealthy diet, stress, and sedentary lifestyles are very common, therefore, learning how to protect our liver has been never much more important. For today's session, we are privileged to be joined by Dr. Sainath, Senior Consultant and Head of Medical Oncology at Star Hospital, Hyderabad. Dr. Sainath brings extensive experience in patient centered oncology care, and he will help us understand the significance of liver health, early signs of dysfunction, lifestyle impacts, and preventive strategies. So, without further ado, let's welcome Dr. Sainath to begin with our session. Hello, sir. A very warm welcome to you. Sir, can you hear me? I think there's some network issue. Let's wait for 2, 3 minutes. I think there was some network issue. Let's wait for Dr. Sanath to rejoin.
Hello.
Hello, yes, sir.
Yeah.
Yeah, there was some network issue, I think.
Yes. 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 Yes.
So a very warm welcome to you for joining us.
Yeah. Thank you, Dr. Muskan.
Sir, we are very delighted to have you with us, and let's just start by exploring key aspects of liver health and prevention. Dr. Sanath, when we say healthy liver and healthy life, so what does it truly mean in medical terms?
So one has to understand actually what the role of liver plays in our body, and when we understand that, we'll understand why it is important to lead a. I mean, why a good liver is important to lead a healthy life. So just an understanding, like how the skin covers the entire body. So same is the mucosa which covers from our mouth to the intestines. So whatever we eat, if it has to go to the inside of our body, liver is the gateway. So most of that, when the digestion which happens in the intestine is absorbed by the blood vessels and it takes that to the liver, what we call the portal venous system. So liver is like the gateway to whatever we eat. So it literally screens whatever we eat, sorts out what is needed, what is not needed, what needs a change, and it is also a storehouse of important nutrients, like sometimes for glucose, for vitamins, as well as it's very important for the detoxification of the some of the food we eat. I mean, some of the substances which can cause harm to our body. So it detoxifies, plays an important role in breaking down the food in the form which the body can use. At the same time, it has a bigger role to play even in the immune function. So it's literally a gateway to whatever outside which is going inside the body. It checks, it corrects, and it balances. So if your gatekeeper is not well, you can understand what happens to your body when it is exposed to this environment. So it is an important organ, and having a healthy gatekeeper for the body is very important to lead a healthy life.
Thank you so much, sir, for highlighting, how liver acts as a central gateway to our overall health. So, sir, moving onwards, can you explain some of the red flags or, some clinical signs of liver dysfunction that people often overlook?
So most of the times, the way the liver problems, they don't have very early signs or symptoms per se,
Mm.
but most importantly, any early loss of appetite, or early satiety or a bloating, some kind of an epigastric discomfort, uh, especially after having food, or not having the willing to eat, the what we call loss of appetite, all these can be early signs. But more importantly, what one has to observe is whether it is persistent. Lot of times in our day to day life, with lot of stressors and our schedule, sometimes we may have this feeling, but that doesn't mean we have a liver disease. But if any of these problems are persistent, then it means there is something problem with the liver. Now sometimes, and all these are other symptoms of a liver disease, but I often consider them as late signs, like unexplained weight loss and jaundice. If it is an obstructive jaundice, it can be an early sign, but a jaundice because of the per se liver problem, liver failure, it's a very late sign. So the earliest and subtle signs would be loss of appetite, early satiety, bloating sensation. These are important things for one should always look for.
Sure, sir. Thank you for explaining the practical insights. And I believe that, timely attention can make all the difference. If we timely tend to our early signs that we are facing, we can definitely prevent liver disease. So, moving onwards and talking
Absolutely.
about the lifestyle that we are following nowadays, how do you suggest, do lifestyle factors like alcohol, obesity, or some viral infections contribute to liver cancer risk?
So if we have to see, more importantly, the way all these lifestyle issues have
Hmm.
caused liver problems historically, majority of the liver problems were because of the viral infections and chronic alcoholism. Now of late we are seeing more because of the other metabolic problems, which are caused directly or indirectly by obesity, and also the food we eat. So the problem is we are starting to eat more junk at a very young age. So if you look into our previous generations, the
Hmm.
access to these the so-called fast food was very
Yeah.
less, and a lot of it was home cooked fresh food. Most of it was vegetable and fruits. So their livers were preserved till their late in the uh, uh, late till their later age. And only if someone had a very bad viral infection, especially the hepatitis B and C, which would actually cause the liver problems, or someone who had a alcohol issue or chronic alcoholism, which would cause the liver problem. Now, what happened is the access to these fast foods or this junk food has increased so much so that now the school kids are getting liver problems because they are introduced at a very young age because of their accessibility, easy to do, and the lifestyle which we have adopted, where cooking has become a very difficult task in an every household, and depending upon refrigeration, lack of
Hmm.
eating fresh food, and also catering to our food cravings, rather than eating what is right, we are eating what we want to eat. So
Yeah.
all these are affecting directly or indirectly the liver health. All of these are causing obesity, causing chronic inflammation, which has a very direct effect on liver health.
I agree, sir. And I think it reminds us how that small daily choices that we make can influence long-term health with us. So, sir, as you were mentioning about hepatitis, so one point that came to my mind is, could you explain how simple screening and getting some vaccination can prevent us from serious liver disease or even cancer?
So, more importantly, when we talk about liver cancer, it
Hmm.
always happens in a pre existing liver disease. So, out of
Okay.
100 liver cancer patients we see, 90% of them occur when there is a pre existing liver problem. And that pre existing liver problem can broadly be categorized into three ones. One is a non alcoholic fatty liver disease, one is alcoholic liver disease, and the third is the chronic hepatitis because of the viral infection from hepatitis B and C. So, out of these three major problems, definitely one can be prevented, which is the chronic hepatitis because of hepatitis B and C. The more important thing is now I think most of the good healthcare practices have seen that there is no healthcare associated spread of these infection with good blood bank practices. The other thing is the universal immunization against hepatitis B. So hepatitis B can be taken at any age, unlike the other vaccines which are recommended, some for adults and some for kids. But hepatitis B can be universally taken for everyone of any age if they haven't taken. So by taking hepatitis B, you are preventing a hepatitis B viral associated liver disease and subsequently liver cancer. For hepatitis C, even though we don't have a vaccine, early recognition, we have really good drugs where we can treat the infection and stop the further liver damage. So when the liver damage is controlled, contained even before a permanent damage is occurred, the likelihood of developing a liver failure or liver cancer also subsides. So vaccination plays a big role. Second
Hmm.
thing would be the alcohol. You know, any amount of alcohol is dangerous. So cutting down on the alcohol, having those lifestyle changes, this cultural changes will have a big impact. So these are certain simple things which can actually have a profound impact on liver health. So, making healthy living choices. So, 90% of liver cancer cases can be prevented when we address all these three major issues which predispose to a liver disease.
Sure, I agree, sir. Always prevention is better than cure. So, sir, talking about liver disease, can you throw some highlights on some nowadays like technologies also at boost? So, some new diagnostic tools are there to detect liver cancer or liver disease?
So most importantly, what we have to do is someone who a regular liver screening, especially in high
Hmm.
risk cases where there is some amount of already cirrhosis or grade 2, grade 3 fatty liver changes. Having a regular ultrasound, a simple ultrasound, would actually give us idea about having early signs of liver cancer. And very high risk cases like who have already have a chronic liver disease, if needed, an ultrasound and a CT will help us detect the smallest of the disease at the earliest of the stage. So these are important screening, especially for the high risk cases. For the general population, I think when we get our liver screens to see whether there is any chronic liver disease, that should help.
Hmm.
Someone who already has a chronic liver disease should be in a more rigorous follow-up with regular ultrasound screening and AFP screenings, and if needed CTs, to identify early to have an early diagnosis of liver cancer if it occurs.
Okay. Thank you, sir, for highlighting how we can diagnose liver disease. So, sir, as we all know, festive season is coming around. So, during festival seasons or some social gathering, how can people protect their liver without being feel restricted?
Yeah, that's a very nice question. The answers, so like you rightly said, lot of the things which we know we should do to have a good health. Most of, because with so much of material available in the social media and in the
Yeah.
print media, everyone knows how to be healthy, but the knowledge should turn into action. That's where it lacks. I think for that there needs to be an important cultural shift. So if I remember when I was a child, the sweets were being
Hmm.
made in my home or exchanged only during festivals. So in
Yeah.
between, we never would actually have a sweet or a craving for a sweet. So I think that important cultural change we have to give. We have to shift. Instead of celebrating sweets, we can exchange 10% of sweets, 90% of dry fruits. That's one important cultural change we have to make, to have some amount, limit the quantity. It's very impossible to stop anything, but limit the quantity. Be aware how much are you taking. Now, second thing is a big cultural shift. What I see, we always, with when we have an issue or when we have to hang out with friends, okay, let's hang
Hmm.
out with a glass of wine or beer. That should go. We can always hang out with a cup of coffee. Actually, coffee is actually protects your liver, whereas
Yeah.
alcohol affects your liver. So these kind of a small cultural changes actually translates knowledge into action. That's very important. So you are still connecting, still hanging out with the friends, still having a good drink which stimulates your mind and tastes your tongue, I mean, uh, satisfies your tongue, and still have a good health benefit. So these are very important things. So you should, if too much of a restrictive living or a restriction to food also makes one feel that it's affecting their quality of life. But right choices, we can always have good quality of life, don't feel restrained, and also have good health. And that's how traditionally people have been living all through these years. So
Hmm.
one should be very conscious about highly processed food and sugary drinks, alcohol, and these things you can have, but you should limit. One should always be. If you're doing it on occasional, see that those occasions are not more than once a month, rather than having it a weekly or these kinds of affair. And if it becomes important to have a social gathering very frequently, which is now the modern day living, which I mean, it's very difficult to change that. But we can change up this thing, instead of uh, meeting over a cup of coffee rather than meeting over a pint of beer.
Yeah, sure. Sir, you were mentioning like coffee is good for liver. Any other food supplements or healthy lifestyle choices that we can make uh, to make our liver more healthy?
So more importantly, what have the scientific evidence has so far told us is
Hmm.
a Mediterranean diet, which is predominantly having more of vegetables, fruits, nuts. The vegetables like cabbage, cauliflower, all these cruciferous vegetables. What we say,
Hmm.
all these are protective to liver, and they promote having lean meat rather than lean meat. When we say lean meat, it's white meat, not the red meat, which causes a lot of inflammation. So all these inflammation, chronic inflammation causes this thing. So you takes more of trans fat or fats which is more in omega 3, all the food, or which is mostly in the processed foods, and processed food, as well as the saturated what we use, these dalda or hydrogenated oils, and all these oils, seed oils, they have higher amounts of these saturated fats as omega 3 fatty acids, which increases the inflammation. And when there is chronic inflammation in the liver, that's what translates to fatty liver
Liver.
disease and cirrhosis. So, cruciferous vegetables have a very nice detoxifying effect. So, it helps in detoxifying a lot of things. And the other thing, nuts, and the more importantly, avoid sugary items,
Hmm.
especially. Whatever carbs you're taking are the ones which should have a low glycemic index. It means, what glycemic index in simple terms means is, You take a food,
Hmm.
if it's releasing good amount of glucose in the body as a spike, as a spike, then it is getting converted into fat, which again causes more of inflammation. A low glycemic index might give the same amount of sugar to the body, but in a very plateaued phase. So that happens when you have good fiber in your diet and which have
Hmm.
more complex carbohydrates. So not starchy vegetables. So less starchy vegetables, more fiber diet, you'll have low glycemic index. So you will be taking same amount of calories, but they are phased out over time. So they will cause less formation of fat and less inflammation. So those would be helpful. The other thing is the green teas and some amount
Hmm.
of limited amount of coffee also have detoxifying effect on the liver. So they do help the liver. These are the broadly things which, if one follows, which are not so difficult ones, frankly speaking,
Yeah.
can be done, and we can have a good healthy liver.
Thank you, sir, for answering that very nicely. So, as we are moving towards end of our segment, we would like to clarify a couple of myths about liver health that are generally seen in public. So first notion is that liver disease only develop and affect people who drink alcohol. Is this true or it is just a myth?
It's just a myth. The truth part is that alcohol people do get disease, but people
Hmm.
who don't take alcohol also get liver disease. And
Okay.
of late, we are seeing more patients who never had alcohol getting liver disease. That is
Hmm.
because of the lifestyle changes the which we are eating. Like I said in the previous this thing. So these are the ones which these patients. So thinking, assuming that I don't take alcohol, so my liver is fine is wrong. Absolutely.
Correct. So,
So
sir, my second question is related to that only. Like you mentioned, many of people think that I feel fine, so my liver must be healthy. So, when should a person be aware of that the disease is developing?
I'll put it in a very simple the lifestyle as a lifestyle thing for us.
Hmm.
So someone who is obese, simple, you can check your height and weight. You have online calculators, you know whether you're obese or not. If you're falling in
Hmm.
the obese category and you don't have any of these habits of alcohol or chronic hepatitis, any of these things, you should definitely get your liver checked, at least by an ultrasound and a liver function test, LFT. One has to see. So the myth about having, I'm absolutely fine, my liver is fine, is wrong, because lot of times the symptoms happen when more than 50 to 60% of liver is damaged. Like I said, jaundice is always a very late sign of liver disease. The early signs are always, satiety, bloating, and all these things. So one should never be under the assumption that the liver is fine. If you are obese, your liver needs to be checked at least once a year to see if you have a fatty liver, whether it is worsening or progressing, because at that point of time you would have no symptoms at all.
Sure, sir. Sir, I would like to also ask one golden rule that people should follow for maintaining long life liver health.
So I think if you are maintaining a healthy liver, it automatically translates to a longer life. The simple thing is have a very good mixed diet, physical activity, so at least
Hmm.
30 minutes a day. And when I say a good diet, which should be good amount of vegetables, cruciferous
Yeah.
vegetables, nuts, fruits, lean meat, less of sugary drinks, have low glycemic foods. This should be, which is very possible. You can have so many tasty dishes with all these features in it. Just change your diet, get vaccinated, and change your cultural practice of bonding over alcohol. Instead of that, try coffee.
Thank you, sir. Thank you for joining us and sharing, your valuable insights and practical advice that everyone must follow for their liver health.
Yeah. Thank you, Dr. Muskan.
Thank you so much, sir.